All right, so let's start this keynote then. It was actually about a year ago, I went to Australia to give the opening address at the equivalent of their ASEP, and Theru, who's here somewhere, invited me to come and give the talk, so thanks for doing that. And they asked me to talk about why emergency medicine, why do emergency medicine, and I thought it was a great opportunity to think about why do we do this ridiculous specialty. So I thought about it for quite a while, and I decided you can divide this into 3 different categories of why you're doing emergency medicine. The corporate why does emergency medicine exist? Then I want to talk about the personal why did I do emergency medicine? And then I want to finish off with some cases, the clinical, the bedside. Why is it so compelling that we keep doing this? So it's 1963, it's a beautiful day in Dallas, Texas, in Dealey Plaza, and the 35th President of the United States is driving in his open car and takes a headshot. It's a horrifying event. We've seen it on the Zapruder film. And even today, it's just a horrible thing to watch. And the world was watching. The most powerful man in the world is horribly injured. And the world asks, what now? The what now is he was taken to Parkland General Hospital, one of the biggest hospitals in the United States, in Dallas. He was seen by a nurse and a second-year resident, the President of the United States. No ED attending. No nurses with TNCC training, no trauma team activation, no well-oiled machine that you know today. And the public watched this and they asked the question, what happens when I get hurt? When I'm sick, where do I go? Who looks after me? Well, after that, the sort of war in Vietnam, which had started a number of years before, was in full swing and was being beamed to households throughout the United States. And returning soldiers were saying, I get better care in the jungles of Vietnam than I do on the streets of Los Angeles or New York or Baltimore. And the public again asked the question, well, where do I go when I get sick, when I'm injured? Who looks after me? We showed the documentary film 24/7, 365 last year, which went through the history of emergency medicine. These people, the men and women of emergency medicine, the grandfathers, started this specialty because the public demanded that there be a place for people to go 24/7, 365, that had people who were trained to look after the critically ill and the injured in those first important hours. Fast forward 20 years later and the show ER started. It was an enormous hit. You probably remember this. Many of you will have a visceral reaction to this. I was a resident when this first came out. Just listening to this music gets me tachycardic. I had to stop watching the show because it was too much like going to work. But this program solidified in the minds of the public the fundamental need for emergency medicine. They realized that there was no getting rid of this. In fact, this show was so powerful, it was shown in Congress on multiple occasions, and it solidified and codified in law that emergency medicine should be open to the public 24/7 without need for payment, that there should be a place for the public to go. And so emergency medicine went from an important specialty to probably the most important specialty. And now 40 years later, if you suggested for a second that we should take away emergency medicine, there would be riots. And so if we ask the corporate question of why there is emergency medicine, the answer is very simple. Because the public demanded it. The public demanded that you existed. And that's the corporate reason of why we do emergency medicine. And that's good, but it's not enough. So now the question is why I did emergency medicine. And maybe some of you can relate to this. I want to tell you my story. So it's the late 1970s, and I'm an awkward teenager, pretty geeky, and I just moved from the country to the big city. No friends, I feel displaced, I feel really lonely. Like so many young men, I thought the only way that I could get out of that awkwardness and that teenage angst was to become a superhero. Because superheroes are respected, superheroes are heard, and most importantly, superheroes get the girl. So I wanted to become a superhero. And at that time when I was 16 years old, my much loved and recently departed uncle, and my cousin's here, his dad, he's an ER doc, he sat me down and made a great argument, and he said, you know, the best way to be a modern day superhero, Mel, is to become a doctor. That's what a superhero is. And so I set that as my task. Now I'm going to tell you something, and let's be very clear. I'm not that smart. It takes a lot of study and more study to put stuff into my long-term memory. It's a real challenge for me. Many of you in this audience are super smart. But what I lacked in IQ points, I make up for with an obsessive-compulsive disorder. So I studied my ass off, and I see many of you in the room can completely relate. I may not be smart, but I just pounded it and worked and studied, and I got the letter in the mail, and it's still, to me, the greatest academic achievement of my life that I got into medical school. It was just stunning to me that I'd done that. I was so proud because I was the first one of 7 in my house to go to college. I was the first one of 7 in my family to graduate from high school. So it was pretty cool. And so my fantasy about being a superhero was sort of intact. I'd done it. I'd made it. But I realized that my fantasy was actually about being a medical student. And that was enough. It was cool being a medical student. I really loved being a medical student. There was lots of, kudos that went with being a medical student. And it was all great until this happened. When I was a medical student outside my house, there was a car crash right in front of my house. And I went out to the car, and there was a guy that had been impaled over the steering wheel, and he was bleeding to death, and he was clearly dying, and I had no effing idea what to do. No idea. I felt completely inadequate. Here I was, medical student, I'm supposed to know something. This guy was dying, and I couldn't do a damn thing to help him. Thankfully, Providence intervened because right behind this car was another car, and a guy jumped out, and he did some magic maneuver, which I now realize was a basic airway maneuver, and he said he'd just gotten off a shift from the ER, and he saved that guy's life. And that was when the seed for me was planted. It was also around this time that MASH was the biggest show on TV, and I saw these guys, and I saw, okay, they were smart, fun, practical. These were the kind of docs that I wanted to be, and that little seed started to grow. Then one day after a histology class, and remember, histology class is that kind of class that every doctor has to do, and it makes you question whether you did the right thing. Histology is effing awful. But there was a CPR class that you could take, and I took that CPR class, and now we were getting somewhere. Because here, for the very first time, I felt like I had some practical information, some useful information that I could use in the real world. And that little seed started to grow a little bit bigger. It's really started to germinate. So I did all my usual rotations. I did pediatrics, I did surgery, I did medicine, I did OB, and I did ER. But ER, that was the one. That was where the excitement was. That was where you got to do procedures. And frankly, I really loved the voyeurism and the lifestyle. I was like, I can do this. It really helped that at the time there was a senior resident who explained emergency medicine to me this way. He said, we take really sick people, make them a little less sick, and send them upstairs. I'm like, I could do that. I'm smart enough, I can do that. And so that's why I did emergency medicine. 25 years on, we sort of laugh at the TV shows that are on now, that it's all glory and inappropriate relationships with coworkers in inappropriate places, and it's all just good times. But you and I, we know the truth. It's an extraordinarily difficult specialty. It's exhausting. Consultants can wear you down. Administrators can wear you down. Patients die. We don't save them all like on TV. They die, and it sucks at your soul. It's very difficult. Very few of us can do this into our 50s and 60s. But still, after 25 years of me doing it, it's still way better than this. So I'm so glad. I'm so glad I got to be an ER doc because it made me a superhero. And that was cool. But now I want to talk about the bedside. Because it's at the bedside that we live every day. And if you're like me, you need to have a continual incentive to do it because it gets harder and harder as you get older and older. So I want to tell you about 5 real cases that I've had in the last 25 years. And with each case, I want to use it as an example of why we do this specialty and why many of you continue and will continue to do this specialty for years. So let's do the first case. So it's late evening and you get the call that there's a man who's got his arm caught in an industrial meat grinder and they can't get his arm out. So they're bringing him and the 400-pound meat grinder to your emergency department. About 10 minutes later, he arrives and you're standing around with the rest of the crew at the bedside like, what the F are we going to do with this guy and his arm in the meat grinder? So you give him a full dissociating dose of ketamine and you crank it backwards. You take the meat grinder and you crank it backwards and it looks something like this. You've seen it before. Yeah. Full dissociating dose of ketamine and we get busy on it.
It's okay.
And it actually works. And we get his arm out, and he actually does extraordinarily well. So, ladies and gentlemen, boys and girls, the first reason that we do emergency medicine is because we get to do some crazy shit with some crazy drugs, and we get paid for it. And that's the first reason. And here's another quick reason we do emergency medicine. You've all seen this patient 1,000 times. And so the second reason you do emergency medicine is very simple. Because if you work in the ER, you are the most interesting person in the room. Nobody has better stories than you. Nobody. So that's the second reason you do emergency medicine, because it makes you the most interesting person in the room. Let me tell you about another case, and this one's really hard to get through. This woman was 32 years old, beautiful girl. Metastatic breast cancer, and tonight she was having a really bad time. She was there with her husband and her mother in our emergency department. And her husband kept saying this over and over again: I love you, and I can't stand this. I don't want you to go. But if it's too much, if it hurts too much, you can leave us. About 2 hours later, she died. She died a good death in our emergency department, but she died, and it was horribly sad, and it still is 20 years later. So if you're like me, you understand that working in the ER, there's no escaping death and suffering, and it reminds you every day that this shit doesn't last forever. So if you have existential angst and you're looking for meaning, there is simply no better place to work, to get perspective, to understand what life's about. So the third reason you do emergency medicine is because this shit is real in the truest sense of the word. And then there's Peter here. Peter was a patient again I remember so well. Peter had HIV and a tumor in his chest that was eroding out. He was developing massive pleural effusions. Nothing was working. He was coming to our emergency department every few days to have it drained. And we'd all drained this many times. On this night, I sheepishly turned to Peter and say, "Do you mind if the medical student does it tonight?" And Peter looked right past me, and he looked right at the medical student and says, "I wouldn't have it any other way. Let's get you trained in this thing right now." And so we did the procedure. And so the fourth reason that we do emergency medicine is because it reminds us that, like Peter, here's a guy in such pain, suffering horribly at the last portions of his life, and all he wants is his life to have some meaning. Let the medical student get taught how to do this procedure. Peter died about a month later in our ER from a massive pulmonary embolism. But it reminds us that we're surrounded by patients and staff whose attitude reminds us what's best about the human spirit. And let me finish with this story. There's so much to talk about this baby Jay. I'm going to talk about who looked after baby Jay at the beginning. So baby Jay was taken to the little emergency department not too far from our giant trauma center by a very distraught mother. And they took baby Jay in, and there was one nurse and one doctor. And we got a call from the doctor from that emergency department, and he said, "Look, I got this kid coming to you. I've diagnosed him with hemorrhagic shock. There are no surgeons at my place. There are no pediatric surgeons at my place. I'm sorry, I broke protocol. I did some stuff, I put them in the back of an ambulance, and I sent them to you. I didn't go through the right calling sort of algorithm, but I had to do it." A few minutes later, the baby arrives in our emergency department. This baby had been intubated, had 2 IO lines in, had an external jugular, and had blood hung. We had the trauma surgeons come down. We did a DPA on this kid, diagnosed them with an intraperitoneal bleed, hemorrhagic shock, and the baby goes to the OR. Now, Billy, I don't know if you remember this, Billy was in the next area over. I was in the resuscitation area, and Billy came over because he heard all the commotion, and this kid is going upstairs, and he picked up the chart in front of the residents, and he's flipping through it, and he goes, in only the way Billy can, "Holy shit, this ER doc in this little hospital tubed this kid, put in 2 IO lines, an external jugular, hung blood, arranged transport in 10 minutes. Who the fuck is this superhero?" And so the fourth or the fifth reason we do emergency medicine brings us back full circle. We do it because we're superheroes. We're superheroes because we have super skills, super knowledge, super perspective, not because we can jump over tall buildings and have X-ray vision. So I'm not sure why you do emergency medicine, but there are 5 pretty freaking good reasons to do emergency medicine. So ladies and gentlemen, boys and girls, Peter Rosenstill has said it best, and he said it this way, and he's an elderly man now. "I did something useful with my life. I worked in the ER. Just remember, what you do matters." I say it every month on our program, and I mean it. What you do matters. It's one of the most important jobs I can ever imagine. Thanks for coming to Essentials. We're going to have a great time here. And now, Let's have the band from South San Francisco High School play us out. Have a great time, and I'll talk to you guys later. Thanks for coming. Herbert out.